Hello, my name is Robyn Guymer. I'm Deputy Director of the Centre for Eye Research Australia and Professor of Ophthalmology at the University of Melbourne. Australian Vision Research clearly advocates for research, and I think it puts at the forefront of our minds research. And I think by advocating to government and our stakeholders about the importance of research, it clearly is the body that we have in Australia to do that. But more specifically, I think in terms of the funding and the research, to give young ophthalmologists that first chance at that first grant, to get them enough money to start on their research journey has traditionally been very important and a very important role that the AVR plays. So my area of research, which is age-related macular degeneration, I think we're at a really important point now, and I'm very excited that we now have all the tools to be able to intervene early in disease. So up until now, we've had to wait for someone to run into problems with their vision and try to make the best of a bad deal. But we now have all the tools and a better understanding of the cause of macular degeneration so that we can now start to intervene early to try and stop people getting to a point where they need all those invasive treatments with injections for the rest of their life. So I think right now we're poised to make a big jump forward in that disease that I've devoted my life to. And what we need is to have a mechanism where we can much more easily work together. And so I think AVR is positioned perfectly to help us join forces, and one of the crucial things we need is an electronic medical record, ideally one that is the same around Australia, but at least have an electronic medical record, and also an ability to interact with our other eye care clinicians, our optometrists and orthoptists, because unless we can work together and share our data, we're going to be so far behind the rest of the world. And if AVR can do anything to help us combine forces, then I see that as a major role that they could play. A key message for stakeholders would be that Australia really punches above its weight in terms of its research, and it's the quality of the research and the impact that research has. And I think to reassure them that any funding or any philanthropy that they may wish to donate to eye research is going to go much further if you donate it in Australia than elsewhere, because of the high quality of our clinicians and our researchers.